Nearly half of American teens suffer from acne scars. And according to a new study by Wakefield Research, nearly 90% of those affected say they'd be willing to give up things like going out to eat and social media, television, sex, and even their smartphones for a month in exchange for better skin. Dr. Barry DiBernardo is a skin specialist and medical director of New Jersey Plastic Surgery. Thanks for being here.
Oh, thank you, Jeff.
How widespread is the problem of severe acne in teenagers?
Well, in that group, as we said, almost half of them have some form of acne scarring. And if you have a problem on your skin, if it's on your body, it's not seen, but this is something visible to everybody they're talking to.
And what proportion of teenagers do we know actually suffer from acne that's severe enough to cause a scar?
Well, in the millennials, it's about 46% have some form of acne scarring.
Amazing. So what do they do about it?
So first thing you want to do is you want to treat the acne, because the scars come from inflammation of acne. If it goes down too deep, it creates scarring in that portion of the skin. So we've had studies we've done with a new laser called the PicoSure, which is a laser that is very different from ones we've used for the last 20 years. PicoSure uses a very short pulse, 1/1,000,000th of a second, and that can go down into the skin, rejuvenate it, and smoothen out these defects with the acne scarring. And the nice thing about that laser also is when you get a treatment, there's no downtime, so you don't have to hide.
Can you do that while you still have acne, or do you have to wait until it's cleared up?
It's best to clear it, because if you still have ongoing acne, you could form more scarring. If there's minimal acne, of course you can still treat, but best to try to take care of the acne first.
What causes acne?
It's a combination of things, of genetic, what you eat, oiliness in the skin. So there's, and usually it's affected in teenagers, but there's adult onset acne also, so it really affects many ages.
Yeah, is it different, adult onset acne, from the kind of acne that we're used to in teenagers?
For our purposes, it's the same type in that it can still form that scarring if you don't take care of it.
And what's the best prevention?
So the best prevention, you can get, if it's mild, you can get things over the counter, but the best thing is to see a board-certified plastic surgeon or dermatologist that specializes in these type things, and get a consultation. And what that allows you to do is you can identify in your location physicians that have these PicoSure devices, and you can do that right from home and get an idea of cost, get an idea of what it will take, and even send them pictures so you can do a pre-consultation. And then if you're a candidate, you could go into the office to be seen.
Great. Thanks for filling us in. Good to talk to you.
Thank you.
Coming up next on Top Stories.